Thank you. Welcome to Medicare 101 with me, Paris. I am an agent here at Bill Gear Insurance. I have been in the insurance industry for about 15 years, and I am ready to talk about the basics of Medicare today. Now, if you're in this room, you probably have heard a lot about Medicare. You might know someone on Medicare. We all have different exposure to Medicare. But today, I want to walk you through the four parts of Medicare, Part A, B, C, and D. I want to go over some potential gaps that you might see in Medicare, how to fill those. I'll tell you a little bit more about different products that I offer. And I'll also go through a lot of real life scenarios so you can really see how Medicare applies to you. My ultimate goal is that I pique your interest enough that you allow me to personally guide you into your Medicare journey. So, one question I like to ask at the start of a Medicare seminar is, who has had a question about Medicare and was unable to find a really easy answer? Well, I'll put both of my hands up, okay? So let me get over here and get my guides going, right? One moment here. There we go. So just to start, when I was going into, I would raise both of my hands if I was in the audience about having a what I thought was an easy Medicare question and it being really hard to find the answer. So let's start with the basic definition of Medicare so we're all on the same page. Medicare is a federal health insurance program primarily for people 65 and older, although it often covers certain individuals with disabilities or specific conditions like end-stage renal disease. So Medicare is divided into four parts. This is still where it starts to get a lot of folks like to say confusing. I just think it adds more puzzle pieces to the puzzle. Medicare is actually Part A, B, and Part D. Part C was added in there, our Medicare Advantage plans, as a combo, just like the letter C, to combine A, B, and D. Now, that is a lot of information, but we are going to go into great detail. So let's start with the different parts. I like to think of this as building our house. So part A is our hospital insurance. You got to have a place to get your care taken care of. Part B covers outpatient care, doctor's visits, preventative services, and durable medical equipment. Part C, like I talked about, we'll go into a lot of detail about each of these, but Part C are those Medicare Advantage plans, which are our alternative to just having the parts individually because it combines them all together. Another thing that stands out about Medicare Advantage plans are the fact that it has additional benefits like vision, dental, gym memberships. A lot of things vary from year to year, but they really combine all of the coverage together. And Part D is our prescription drug coverage, which helps cover your prescription coverage. If you look into your folder, if you're online, I can get one of these emailed to you. This is going to be your best friend when after you leave this seminar. This is the A, B, C, and D's of Medicare. It really goes into detail on what's covered for Part A, Part B, Part C, and Part D. And it also has the 2025 numbers, which we'll talk about here. Okay. So those are the four parts of Medicare. Let's really start to dig into one part at a time. Let's start with Part A. So Part A right here. This is Linda. She's 65, recently retired. She's applying for Medicare. She qualifies for a premium free Part A because she has worked and paid Medicare taxes for over 10 years, which is 40 quarters. So let's dig a little deeper into that. What makes us eligible for Part A? So Part A, you must be 65 or older unless you fall into one of those special categories with disability. You must be a U.S. citizen or legal resident, work 10 years or a spouse did. If you have a little different situation. We can talk about that separately because Medicare really is different for each person. But if you fit these general criteria, you will be eligible for Part A, and you would get Part A premium free. If you have not worked long enough, there are still ways to pay to play. On average, right now for 2025 in Part A, you would be paying $505 a month. Now, that is a big difference compared to zero. Again, just a reminder to get Part A locked into our mind. That includes inpatient hospital care, skilled nursing facility, hospice care, limited home health care. In 2025 this year, because our prices change every year, our hospital deductible, so think of every time you're admitted to the hospital. Some of us, that may be a pretty regular thing. Others, that might not be so often. It's very important to think about that when we're making our Medicare choices. So, our hospital deductible is $1,632 per benefit period, which means per hospital stay. Days 1 through 60 is 0 per day. Days 61 to 90 is 408 days per day. Days 91 to 50 and so on. But if you've ever been admitted to the hospital, they do not like to keep you a long time. But that is one of those out-of-pocket expenses that you can expect to have if you go to the hospital. But for Miss Linda here, she's all signed up, so she is confident that her Part A is taken care of. Now she'll continue on to Part B, which, let's talk about it, a little different situation. Just to keep Medicare as interesting as it truly is. Now, Part B gets a little bit more detailed, so we'll talk about it on two different screens. But let's meet Robert, who is 68. He's a retired contractor. So what we've learned in Part A, remember, you qualify for Medicare at age 65, but Robert delayed enrolling in Medicare Part B when he turned 65 because he was still working and had employer coverage. Now that he's retired, he's signing up during his special enrollment period to avoid a late penalty. So, Robert here, age 65 or under with a qualifying disability. With Part B, it's a little different. You must enroll and pay a monthly premium. It's not automatic like Part A. You have to enroll during certain times. There's initial enrollment period, there are special enrollment periods, and then there's general enrollment if delayed, kind of like this situation here. Part B covers your doctor's visits, covers your outpatient tests and labs, preventative services, durable medical equipment, and some outpatient surgeries and ER services. In 2025, the monthly premium for Part B is $185 base rate. If you worked really hard and had a higher income, you will have an IRMA. And what that means is you will just have a higher Part B premium. That is all calculated 2 years back based on your income. So that will change as you go through your Medicare year journeys. The annual deductible, so just your health deductible, is $257. After you meet the deductible, Medicare always pays 80%. Your out-of-pocket expense would be 20%. So if you just stop here, we're going to talk about drugs. There's now no out of pocket maximum unless you're enrolled into a supplement or an Advantage plan, which you can just have regular traditional Medicare, add on your prescription, and you're good to go. But that means that there's no ceiling with how much you can pay from year to year for benefits. All right, let me make sure I get ahead on my notes here. And let's go to my second slide for Part B, just to get in a little bit more detail. So this is where you hear a lot of the penalty nightmares or stories, because failure to maintain medical coverage could result in a lifetime penalty being assessed when you enroll in Part B. So non-enrollment penalty for Medicare Part B is 10% surcharge for each year you should have enrolled but didn't. The reason does not matter. So remember, this is your physician services. If you are already covered, you don't need to enroll until the coverage ends. This is what we're talking about when you have already have credible coverage. So normally you have it through an employer or your spouse's employer, but you must have credible coverage before Medicare to not get that penalty. COBRA does not count as credible coverage. So if you are receiving COBRA from an employer, you have 8 months between separation of the employer to get enrolled into that. VA coverage does not consider credible coverage. So this is why it's important to be mindful of your enrollment time so you do not face any penalties. Let's move on to part D. Skipped around a little bit. We'll go into part C after because I really want us to understand what the Medicare original parts are if that is what you decide to do. So let's talk about Sheila, who's 70, a retired pharmacist. She takes several prescriptions to manage her chronic condition. She chose a standalone Medicare Part D plan, and she still hasn't decided whether or not she'll stay on original Medicare or add a Medigap coverage or even an Advantage plan. But in order to qualify for Part D, you must be enrolled in Medicare Part A and or Part B. This is available as a standalone plan if you're deciding to stay with original Medicare, or it can be bundled instead of a Medicare Advantage plan. Sheila enrolled during her initial enrollment period so that she could avoid the Part D late enrollments penalty. If she had waited, she could have paid 1% penalty for each month delayed. So, a little bit more detail. Part D penalty is assessed each month that you don't have credible coverage. This is very different than the penalty for Part B. And remember, these penalties stay for a lifetime. Although it's deemed optional coverage, if you do not maintain credible coverage, once eligible, you may have a penalty. So we can talk about that in detail. We have next steps after once we complete the presentation that will help you get ready to make sure when you can enroll. Let's talk a little bit more about Part D. I wanted to break this up. So Part D with Sheila. There's also something new that came out in 2025, which is considered the M3P program. It's a Medicare prescription payment plan, which allows you to pay higher drug costs in monthly installments. And the max out of pocket for drugs is $2,000. So what this means, let's go through the deductible phases. You would pay $590 out of pocket before your coverage begins for prescription, but a lot of times tier 1 and tier 2 meds are not included in that deductible. It really just depends on what Medicare option you select. So traditional or not traditional, most common blood pressure or cholesterol drugs are normally tier 1 or tier 2. When you start to get into medicine to maintain diabetes or those more expensive drugs, they go to the higher tiers, and that's when your deductible applies. So you would pay your copays, your coinsurance. Here's when we get into the M3P. If you have a very expensive drug, they'll take that total big amount that you are responsible for the whole year, and they'll break that out down into monthly installments. So that way you don't have to come up with it all at front and you're able to still have your medication. Once you spend $2,000, then you will pay $0 for the covered prescriptions for the rest of the year. You still pay your premium if you decided to keep Part D separately. Okay? Now that we went over Part A, which is our hospital, Part B, which is our doctors, Part D, which is our prescription, let's start talking about how we can fill in the gaps. First, before we get too far into that, just to go over what Part C is, the Medicare Advantage plan. It's a private insurance plan. It's not given through the government like Part A and Part B and Part D, but it's able to be called Part C. It often includes additional benefits like vision, dental, and hearing coverage, but those benefits change from year to year and can be removed at any time. It's one-stop coverage, so Medicare Advantage plans really do a great job with combining all of the Medicare parts. Like I said, it has extra benefits that help, and one good thing too is it gives you an out-of-pocket max. So like we talked about earlier, how Medicare don't have a ceiling. This Advantage plan is one that gives you that. Now, Medicare Advantage plans, they have a variety of costs. You can have something that has a $0 premium, or you can have a smaller premium or a higher premium. It really just depends on which benefits are going to work best for you. So let's stop really quick and see if these are myths or are they facts. So is Medicare free? Now, while Part A can be free, but we are know the answer to this. Medicare is not free. It has a lot of out-of-pocket costs. Number two, myth or fact, Medicare covers everything. Well, as we learned from myth one, this is also a myth because Medicare does not cover everything and there are gaps, which we're going to get right on into. So these are some gaps that we need to be mindful of, that Medicare doesn't cover everything. But we're going to talk about solutions for filling the gaps, like the Medigap supplement insurance, Advantage plan, and Part D. We kind of have already went over these, but this way you'll really be able to understand how to fill those gaps. So let's talk about Medicare supplement. So here's Charles. He's 72, a retired high school principal. He's enrolled into the original Medicare Parts A and B. He really values his freedom to see any doctor that accepts Medicare nationwide and doesn't want the hassle of having networks or referrals. So he's decided to go with a Plan G. Now, for supplements, there are a lot of different letters that will fit and fill in the gaps differently. Plan G is the one that you pay a premium and it covers everything. We'll go into more detail about what that looks like, but we'll mainly be talking about Part G. And based on your individual circumstances, sometimes a different plan might be better for you. But let's talk about why Charles decided to go with this Medigap Plan G. So he travels between Texas and Florida and visits his kids and wants nationwide coverage. Now, this is not to be confused with emergency care. If you are traveling and you have an emergency, Medicare will take care of that. Now, if you are wanting to stay somewhere or moonlight for half the year and you want to have doctor's appointments and specialists, that is where this supplement really shines because you are able to do that nationwide. It's very predictable. You pay your premium so you can control your max out of pocket cost. So you don't really have to worry about surprise billing. So let's show how this kind of what I'm talking about. So as we talked before, this handy dandy paper that will be your great resource. If you're not in the room, email me and I'll get you a copy of our ABC chart. But Medicare Part A deductible is $1,632. If you have a Plan G, that's going to cover that completely. Your coinsurance, that daily cost, that's going to be covered. So basically, Medicare pays the 80%, the out-of-pocket 20% that you will be required to pay. Since you're paying for your premium, that is going to be covered. Okay. Um, Monthly premium for Plan G does vary, and this is something that goes up every year. And also, this does not cover your 2025 deductible at $257. So that is what you will be expected to pay. Remember with supplements, another thing that's important to remember is this does not include the Part D drug plan, so that's something that Charles will have to add on. He enrolled during his open enrollment period 6 months after enrolling in Part B, so he wouldn't be denied for any pre-existing conditions. He's confident in his coverage because he has the flexibility and the freedom that he wants. So let's go into a little bit more of what Medicare does not cover. Because now, since we're building our house, we have our Part A, that's the hospital, Part B, that's the doctor, Part D, that's our prescription. We've either decided on an Advantage plan to bundle all those together, or we, like Charles, have gotten a supplement plan and going to add in our Part D. So we figured out those original gaps. Now let's talk about some other gaps that we will see as we age through life on Medicare. Long-term care. So long-term care, Medicare does not cover custodial care or long-term care in nursing homes. It only covers medically necessary skilled nursing care for a limited time after a qualifying hospital stay. So think about any time you would need long-term care. Short-term care can go into this as well, but if you have surgery, you're going to have your surgeon, your doctor that takes care of that. If you need medication, prescription drugs, or if you need, say you need something changed or tubing changed or something and you're at home, Medicare will cover that. Now, if you need help with eating, cooking your food, cleaning, getting dressed, any of your ADLs, that is not included in coverage from Medicare. So let's go over a couple of scenarios to help you kind of think about when this gap would come into play. So think about if you're staying at home. We have Mrs. Johnson here. She's 78. She lives alone and has arthritis. A home health aide visits daily to help with bathing, light housekeeping, and reminders. Helps her to be able to keep her independence. Now that is something that's not going to be covered by Medicare. Let's go over a different scenario. Someone is living in assisted living facility. Example, Mr. Taylor is 81. He has mild memory loss and struggles with cooking and managing meds. He moves to an assisted living community to get meals, laundry, and daily routines. So So that is great for someone who doesn't want to be completely independent but wants to keep some of their independence. That is something that is not covered. So let's think about adult daycare services. Mr. Lopez, 75, lives with his daughter who works full time. She attends adult daycare during the day for socialization, meals, and supervision, then returns home in the evening. So all of these different scenarios, just think about how you want to age, or if something happens when you can't do your normal duties, how do you want to recover and how do you want to maintain your life? That's really important to think about your plan when it comes to making your Medicare choices. Next, home health care services. That's something else that is not uh, covered with Medicare. So Medicare Part A and Part B, they do cover some limited home health services like a part-time skilled nursing care, physical therapy, those things that really help with aiding you improve your health. Now, anytime if Medicare or those nurses feel like them coming to do that physical therapy or occupational therapy or anything like that is not helping to improve your health, then that is not going to be covered in Medicare. So skilled, however, let me go. Let me look at my notes, make sure I'm not missing anything. Okay, so let's go over the difference kind of what's medical versus home health so you get an idea. If you need medication administration, wound care, catheter care, monitoring vitals or health status, that is medical. That's skilled nursing care. That's something that Medicare could pay for. Physical therapy, occupational therapy, again, that's something Medicare will pay for. Sorry if that got on the mic. Now, light housekeeping, meal preparation, help walking, medication reminders, those are all non-medical, which means Medicare would not cover that. Long-term care planning, counseling, those are all things that would need to be separate from Medicare. Now, medical equipment like oxygen therapy, wound care supplies, those, if you have a prescription from your doctor, would be covered. Let's go over a couple more things that Medicare does not cover, just so you're well rounded on the benefits we have. So routine dental care, dentures, most vision care, if you don't have the Medicare Advantage plan, that's not going to be covered by Medicare. That would be a gap that you would need to plan for. Hearing aids and exams, again, outside of the Advantage plan, that is something that you would need to have a plan for. Long-term care, as mentioned earlier. I think really understanding these gaps is really important. Sometimes when you get to retirement, maybe you've had a lot of your major dental work already completed. That might not be a concern, but you really want to plan for um, the long term, like aging all the way to 97. So now that we went over a lot of information, let's talk about what our next steps are. Our next steps are first, create a social security account. After this seminar today, and if you're interested online, you can send me a message, but you create an account on SSA.gov. That will tell you if you're eligible for your 40 quarters. It gives you a nice graph that tells you an estimate of how much you will receive once you retire. But what I am offering to you is a link that will have you fill out a lot of that information, but it will give me a detailed report almost on steroids that will help me be able to really help you plan for your future down to month by month. If you're already collecting Social Security, you do not need to enroll into Medicare. You will automatically be enrolled in Medicare Part A and Part B with the option of disenrolling into Part B. As we mentioned, there's special situations. So if you're collecting Social Security disability, you are automatically enrolled into Medicare Part A and Part B effective the 25th month of receiving benefits. Next, just a reminder about when you are eligible. 3 months before the month of your 65th birthday, the month of your 65th birthday, 3 months after your 65th birthday, and you have a 7 month initial enrollment period. If your birthday happens to fall on the first of the month, you would start your Medicare a month early. Also, if you have decided to delay your Medicare and continue to work, you have, depending on Part A or Part B, Part D, what we're talking about, you have a timeline, but you are still eligible to enroll when you separate from the employer. Just to start to wrap us up, true or false, Medicare covers 100% of your health care costs. That's going to be false. You can switch Medicare plans during the annual enrollment. That is very much true. Today we cover what Medicare is in its 4 parts, common myths, important timelines. We talk through how to maximize your benefits and plan for a coverage gap. We talked about what Medicare doesn't cover and how to plan for long-term care or home health services. Also went over next steps. I promised that I would tell you other products that I offer. I also offer cancer and heart attack coverage, dental, life insurance, final expense, health insurance, Medicare, as we discussed today, and long term options. If you enjoyed or learned anything today and would like to support me, here is my information. You can schedule a meeting with me. You can follow us on Facebook. Definitely subscribe and check me out in the community, but I'm committed to helping you understand how insurance works for you. And thank you so much for joining me. I hope you learned something today.